Let's discuss the 5 transporting points, Yin spring points, Spleen 2, Great Metropolis. Location, Spleen 2 is on the medial side of the big toe at the junction of the shaft and the base of the proximal phalanx, distal to the first metatarsophalangeal joint. How to find? On the medial aspect of the big toe, palpate from distal to proximal towards the metatarsophalangeal joint until you feel the junction at the shaft with the base of the proximal phalanx. Spleen 2 is located distally to the base of the bone, which forms a distinct step and slight inferiorly to its outer curvature at the border of the red and white skin, the sole dorsum of the foot. Located in comparable position are bladder 62 on the lateral border of the foot, LI2 on radial aspect, and SI2 on the ulnar aspect of the hand. Needling 0.2 to 0.5 June vertically or obliquely, just below the lower border of the bone. Caution, painful point. For the action indication, regulates and supports the spleen, harmonizes the lower burner, and clears heat. Special features, Yin spring point, fire point, tonification point. Although this is the tonification point of the spleen according to the 5 elements, it is seldom used to tonify the spleen, as it is more frequently used to clear heat in excess patterns. In particular, it is used in the course of a febrile disease from exterior heat at its beginning stage to cause sweating and clear heat. It also calms the mind and is used when mind is unsettled against a background of heat in the spleen and stomach. Although this is the tonification point of the spleen according to the 5 elements, it is seldom used to tonify the spleen. It also clears heat in excess patterns, the febrile diseases from exterior heat, calms the mind. Mind is unsettled against the background of heat in the spleen and stomach. Spleen 2 is the yin spring and fire point of the spleen channel and the subject of somewhat contradictory statement in different classics. The classic of difficulty says that the yin spring points are indicated for heat in the body, and indeed the yin spring points of the 12 channels are usually the principal points to clear heat of the excess or deficiency type from the respective sangpu or channel. The illustrated classic of acupuncture points on the bronze man says, when the spleen is deficient, reinforce spleen 2. Reflecting the status of spleen 2 as the mother point of the spleen channel, fire is the mother of earth, according to the principle of tonifying the mother to nourish the child. The classic of Jade Dragon simply states that spleen 2 can treat disharmony of the spleen and stomach. The spleen dominates the function of the digestive system as a whole, including stomach and intestine. Its transportation and transformation function places great demand on the spleen's qi, and in disharmony, the spleen tends to deficiency, which is why most of the spleen channel points distal to the knee have some effect on tonifying the spleen. This deficiency may underlie the patterns of spleen dampness or damp heat, either because impaired transformation leads to the generation of these pathogens inside the body, or because when the spleen is deficient, the body is especially vulnerable to attack by exterior dampness and damp heat. It is this picture of spleen deficiency combined with dampness or damp heat that is able to reconcile the different statements made in the classic concerning spleen 2. It should be emphasized, however, that among the more distal points of the spleen channel, the spleen tonifying action of spleen 2 is relatively minor, and its primary action is reducing excess patterns. Spleen 2 is indicated for excess dampness or damp heat manifesting as sudden swelling of the forelimbs, heaviness of the body with pain of the bones, swelling of the limbs, and oppression of the chest. These indications reflect attack by exterior dampness or damp heat, often as consequence of underlying spleen deficiency. Spleen 2 is also indicated for heat patterns of the stomach and intestine, such as abdominal distension, epigastric pain, vomiting, diarrhea or constipation, and sudden turmoil disorder. The indication agitation when hungry and dizziness when full reflects a pattern of phlegm heat in the stomach. The heat-clearing action of spleen 2 extends to the treatment of febrile diseases and is especially indicated when fever are accompanied by absence of sweating. Finally, spleen 2 may be used as a local point for disorders of the big toe in combination with points such as spleen 3 and liver 2. The LIEQUE talks of using spleen 2 and spleen 3 together to treat the spleen. DADU can infuse earth with resonance of fire, whether lightheartedness and relaxation when spleen becomes too self-absorbed, and serious maturity, trust, and expansiveness when earth has become cold and bogged down, the light and inspiration of the Shen necessary for the prompt that initiates intent into thought and form. A capital or metropolis is a busy place full of exchanges, negotiations, and minglings, such as spleen is constantly busy at our center. That DADU can bring light and vitality to the spleen. As a tonification point, it reconnects the mother-child relationship along the Shen cycle, bringing nourishment and support to earth, which supports all the officials. Great capital can tonify spleen yang, where there are signs of deficiency and cold damp, mental or physical lethargy, cold extremities. When earth has become cold and inert or overheated, it is hard to feel strong in the body or think clearly. Things become stuck in a rut rather than circulating freely or become agitated and clustered. Spleen 2 can help regulate the temperature of the spleen so it can manage all its relationship and transition with ease. Regulates the spleen and stomach and reduces digestive stagnation. As a fire point in Yin Spring, spleen 2 is used to expel pathogenic factors, to clear heat in the early stages of fever due to exterior heat, and to induce sweating. In particular, it is used to clear heat and damp heat from the spleen or stomach. Those having vomiting, diarrhea, epigastric pain, insomnia, restless dreaming, reddening of the flesh or eyes, or to assist in B syndrome to loosen stiff, painful joints affected by heat. Empirical first aid point for sprain and fractures. Thank you for your attention.
Let us continue with 5 command points. This time we talk about lung 7, broken sequence. Lung 7 is located on the radial aspect of the forearm, directly above the styloid process of the radius, approximately 1.5 tsun, proximal to the wrist joint space, or the wrist crease in a V-shaped groove. How to find lung 7? Place the palpating forefinger on the anatomical snuff box, which is LI5. From there, glide proximally over the styloid process of the radius and locate lung 7, where the finger can palpate a cleft between 2 tendons, brachioradialis, abductor pollicis longus, or using the tiger mouth grip. Spread the thumb and forefinger of both hands, crossing them so that the forefinger of one hand comes to rest on the styloid process of the other, but avoiding bending the wrist. Lung 7 is located directly below the tip of the forefinger in a V-shaped groove. Needling of lung 7. Lift the skin above the styloid process by pinching it. Insert the needle 0.5 to 1 tun obliquely and proximally. That means reducing. Or distally when you tonify. Caution, cephalic vein. Actions or indications of lung 7. Supports the occiput and head. Releases exterior, expels wind, descends lung chi. Opens and regulates renmai. Regulates water passages. Opens the channel and Luo-connecting channel. Alleviates pain. Special features of lung 7. Luo-connecting point. Opening point of the renmai. Madanyang heavenly star point. Kawu command point of the occiput. Exit point. Lung 7 is an extremely important point. A favored point when there is grief, sadness, and oppressive feelings in the chest. Where these feelings have been held in and incompletely expressed, it can stimulate a beneficial release for the patient, often accompanied by tears. The po reside in the lung, and long-term deep sadness and grief can afflict their role in the rhythmic automatic maintenance of the processes of life, leading to shallow or constrained breathing, tension in the area of the shoulders and chest, and uneasiness of the spirit. Being the opening point of the renmai, lung 7 can open the chest and affect the upper and lower jaw. Used with kidney 6, the coupled point, lung 7 tonifies yin, regulates uterus, affects and moistens the throat, as well as stimulating the descending of lung qi and the grasping of qi by the kidney, and so is useful in chronic asthma from lung and kidney deficiency, as well as edema of the face. The far-reaching effect of lung 7 on the upper jaw also supplies a nourishing influence to the heart and pericardium meridians. The nose is the opening of the lung. Lung 7 is said to open the nose. It regulates lung qi, stimulates dispersing of lung qi to circulate the way or defensive qi, opening the pores and stimulating sweating. This ability to release exterior means it is often used in the early stages of invasion of exterior wind, colds, and flu. Lung 7 is frequently combined with LI4 or LI20 in this context. These combinations may also be used to eliminate toxins from mind and spirit. The receiver of qi needs to have the clearest qi possible. Otherwise, all sorts of distortions can occur in the body, mind, and spirit, leading to depression, narrowed perspective, loss of purpose, and a constant sense of disappointment in life. As the best point to stimulate the descending of lung qi, it is beneficial in all types of cough or asthma. Being the luo or junction point with large intestine, it can affect LI meridian as well as lung meridian problems, including neck, face, and shoulder problems, shallow breathing, oppression in the chest, as well as constipation. The lung and large intestine as receiver of qi and drainer of the dregs are key in the beginning and end of life, entrances and exits. The luo junction point has a harmonizing action on the internal-external relationship of this pairing. Furthermore, lung 7 is seen not just as a junction point for lung, but acts to regulate and harmonize the environment for all the officials to work within because of the role of the po in the automatic rhythmic maintenance of life. The lung controls water passages. Lung 7 affects opening of water passages and is helpful in patterns of urinary retention from deficiency, which often affects older patients. Stimulates descending and dispersing of lung qi, circulates wei qi, and releases exterior. The name of this point, broken sequence, is an ancient term for lightning. This name may be understood in three ways. First, the electric sensation that may be generated when needling this point. Second, the ability of lung 7 to clear heaviness and oppression of the chest in a way that a lightning storm clears the sky. And third, the southern fork in the lung channel at this point. It is notable that several of the Luo-connecting points, for example, stomach 40, bladder 58, kidney 4, are located at sites where the channel suddenly changes direction. And in the case of lung 7, this fork takes it almost as far as the pathway of the LI channel, emphasizing the close affinity of lung 7 to the lung-spared Yang channel. Lung 7 was included by Madan Yang, the great physician of the Qin dynasty, among the 11 heavenly star points, his grouping of the most vital acupuncture points, and was indicated by him for one-sided headache, wind painful obstruction and numbness of the whole body, obstruction of phlegm in the upper body, and lockjaw. The glorious anthology of acupuncture and moxibustion by the Ming Dynasty author Gao Wu includes lung 7 among the 4 command points for disorders of head and neck. In the Ode of the Obstructed River, the use of lung 7 is referred to as one of the 8 therapeutic methods. In this description of the application of the 8 confluent points of the extraordinary vessels to affect specific symptoms and areas of the body, lung 7 is indicated for disorders of head region, rebellion and blockage of phlegm, and dry throat. The clear emphasis on the ability of lung 7 to treat the head and neck region in each of these 3-point groupings is surprising, since the lung channel does not ascend higher than the throat. The effect of lung 7 on the head region as a whole can, however, be explained by the following factors. First, the action of lung 7 on expelling and pacifying wind, whose nature is to attack the upper portion of the body. And second, the close connection between lung 7, the Luo-connecting point of the lung channel, and its exteriorly related LI channel, which does ascend to the head. Thank you for your attention.
Today, let's start discussing the extra points. So first, we have here 2 points, the 4 alert spirit point, or the Sishencong, and the hall of impression, or the Yintang. The 4 alert spirit, or the Sishencong, or the EXHN1 point. This is a group of 4 points, each located 1 soon from Do20 in anterior, posterior, and lateral position. So how do we find these points? First, we locate Do20 on the highest point of the head at the junction of a line connecting the apices of the ears and the vertical midline. Alternative location method. First, we locate Do20, which is 5 soon, superior to the anterior, and 7 soon, superior to the posterior hairline. EXHN1 forms a star-shaped group of points around Do20. 2 points are located at a distance of 1 soon each on the Do-my, whereas the 2 are located 1 soon from Do20 in a lateral direction. Needling this point is 0.5 to 1 soon obliquely towards Do20. For its action and indications, this calms the shen, alleviates pain, calms wind, and benefits the eyes and ears. The actions and functions of these points are similar to those of Do20. These points are mostly used as local points for the treatment of epilepsy. So to summarize its function, Sishencong extinguishes interior wind in epilepsy and wind stroke. It calms the mind in manic depression and insomnia, and brightens the eyes and benefits the ears in blurred vision and deafness. The 4 points Sishencong were first discussed in the sage-like prescriptions from the Taiping era on the 10th century. As the name 4 alert spirit implies, these 4 points are able to pacify interior wind which rises to harass the head and brain in wind stroke, epilepsy, dizziness, etc., and to calm the spirit in mania, depression, insomnia, and others. In clinical practice, these points are either used as a group, all four being needled together, or through needled from DADU 20. Next point, we have the follow-up impression Yintang, or the EXHN3. Needling this point is through, first, we have a pinching skin method. With the thumb and index finger, form a skin fold above the point and insert the needle 0.3 to 0.5 tune transversely from superior to inferior into the fold towards the root of the nose. As an alternative method, oblique or transverse or subcutaneous insertion towards the eyebrows, where bladder 2 is, or prick to bleed. For its actions and indications, this point calms the shen, benefits the nose, eliminates internal wind, opens the channels, and alleviates pain. For its special features, this is commonly used extra point with a harmonizing effect. Yintang is located on the anterior midline, or lumine, between the eyebrows. So how do we find this point? We locate the glabella, a smooth surface on the frontal bone, directly above the root of the nose, between the superciliary arches. Then locate EXHN3 or Yintang in its center, on the midline and between the medial extremities of the eyebrows. Located along the superciliary arches from the medial to lateral are bladder 2, EXHN4, and triple Werner 23. Yintang point extinguishes interior wind and it relieves convulsions in children. It is therefore used at the late stages of children's febrile diseases. More commonly in everyday practice, Yintang is used to calm the mind and to relieve anxiety and insomnia. To summarize its function, Yintang extinguishes wind in epilepsy, vertigo, and convulsions, calms the mind in anxiety, insomnia, and fright. It also benefits the nose in nasal congestion and discharge and in sneezing. The extra point Yintang was first discussed in the essential questions. It is curious, however, that such an important and commonly used point was not classified as a point of the governing vessel on whose pathway it lies, lying between the eyebrows in the area ascribed to the third eye by many traditional cultures. Yintang has been considered by some Qigong authorities to be the location of the upper dantian. Yintang is commonly used in 4 clinical situations. First is a powerful and effective point to calm the spirit in the treatment of insomnia, anxiety, and agitation. Second, to activate the channel and alleviate pain in the treatment of frontal headache. Third, to benefit the nose in the treatment of nasal congestion and discharge, rhinitis, sinus pain, nosebleed, etc. And fourth, to pacify wind in the treatment of chronic and acute childhood fright, wind, or infantile convulsions. So the use of Yintang in combinations with other points. So for head wind following intoxication, Yintang is combined with bladder 2 and stomach 36. For insomnia, Yintang is combined with heart 7 and spleen 6. For hypertension, Yintang is combined with lung LI11 and stomach 36. For headache, Yintang is combined with GB20 and Taiyang and LI4. For rhinitis, Yintang is combined with LI20 and LI4. Thank you for your attention.
We continue with the back transporting points. Bladder 43, vital region, shoe. Location, tritune lateral to the posterior midline on the level of the lower border of the spinous process of the fourth thoracic vertebra, T4. How to find after locating the spinous process of C7, count down 4 spinous processes to the lower border of the spinous process of T4. Located on this level and 3 tune lateral to the midline is bladder 43, or locate bladder 43 by using the spinous process of T3, generally on the level of the easily palpable medial end of the scapular spine as a reference point. Located on the same level are a point of EXB2, 0.5 tune lateral to the midline, and bladder 14, 1.5 tune lateral to the midline. Needling obliquely 0.3, 0.5 tune. Moxibustion is often used on this point. Caution, pneumothorax. Action and indication, bladder 43 tonifies and nourishes the 5 Sang organs: lung, heart, kidney, stomach, and spleen. Nourishes yin, clears heat. Calms the shen, strengthens the original qi, the yuan qi, eliminates phlegm. Special features, important point for deficiency syndrome, classic indication. Bladder 43 is an intriguing point. It has a very old history and is mentioned in one of the earliest references to acupuncture. Its name is very difficult to translate. The two combined character, Gao Huang, indicate the space between the heart and diaphragm. This is supposed to be the location of all chronic and nearly incurable diseases. Hence, the use of this point in very chronic diseases with great debility. This point tonifies the qi of the whole body and is used when the person is very debilitated after a chronic illness. In these cases, it is usually treated with direct moxibustion with moxa cones. It nourishes the essence and can be used for kidney deficiency manifesting with nocturnal emission, low sexual energy, or poor memory. It nourishes lung yin and is used to tonify the lungs and promote the yin after a chronic lung disease that has injured the yin and left the person with a chronic dry cough and debility. In this case, it is needled only and moxa is not used. Finally, it invigorates the mind by promoting the essence function of nourishing the brain by nourishing the heart. It therefore stimulates memory and lifts the spirit, especially after a long-standing disease. Summary, it nourishes lung yin, dry cough, wheezing, coughing of blood, exhaustion, night sweating, consumption, weight loss. Nourishes the heart in poor memory, palpitation, insomnia, dizziness. Nourishes the essence, those with seminal emission, nocturnal emission, impotence. It tonifies the stomach and spleen, those with deficiency of stomach and spleen, undigested food in the stools, weak limbs. The name Gao Huang can be as a vital region. This concept implying one of the deepest and most fundamental region of the body is first mentioned in Master Suju tradition of the spring and autumn. One of the earliest textual reference to acupuncture. The Prince of Jin, who was gravely ill, sent for the famous Dr. He Huan. After examining the patient, the Dr. Huan declared the disease had settled in the Gao Huang region between the heart and the diaphragm, and hence it cannot be purged. It cannot be reached by needling, herbs, and will not be penetrated. There is nothing to be done. Bladder 43 was comprehensively discussed in a text called Method of Moxibustion at Gao Huang by Shuangzu in 1128. Shuang was inspired to write this book after being cured of various diseases, including malaria and beriberi by 300 moxa cones burned on Gao Huangshu, bladder 43. He measured the location of bladder 43 on the people of various body builds and gave diagrams and specific instruction for locating the point. In discussing this point, Sushi Mao in 1000 Ducat formula simply states, bladder 43, there is no disorder that it cannot treat. And once moxibustion is completed, it causes a person's yang qi to be healthy and full. Many classic texts says that bladder 43 is contraindicated to needling and emphasize its treatment by moxibustion. For example, the illustrated classic of acupuncture points on the bronze man recommends the application of 100 or even as many as 300 moxa cones to bladder 43. Early texts, however, stress that after moxibustion at bladder 43, moxibustion should also be applied to points below the umbilicus, example REN 6 and REN 4, in order to conduct downwards the heat thus generated. Careful examination of the classical indication of this point demonstrate its action on the lung, heart, kidneys, spleen, and stomach. Like bladder 13, bladder 42 is able to treat severe deficiency, especially of the yin of the lungs, and is indicated for consumption, cough, capping of blood, steaming bone disorder, night sweating, and emaciation. By both nourishing and calming the heart, it is applicable in the treatment of poor memory, pounding of the heart, insomnia, and phlegm fire mania. Acting on the kidneys, it is able to treat seminal emission with or without dreams and impotence. By streaming the middle jaw, it is able to treat feebleness and deficiency of the spleen and stomach, undigested food in the stool, and weariness of the forelimbs. So great was the tonifying action of the bladder 43, considered to be that it was said to strengthen the original qi and treat every kind of deficiency, the 5 types of taxation, and the 7 injuries. Finally, it is interesting to note that bladder 43 was also indicated for phlegm diseases, and San Shimao, in his supplement to the 1,000 ducat formula, says it stopped phlegm in chronic disease. The importance of phlegm as a pathological factor in difficult and chronic diseases is long documented and is reflected in such saying as the 100 diseases all pertain to phlegm. Strange diseases often involve phlegm, and there is no place that phlegm cannot reach. Thank you for your attention.
Now let's talk about the points of the large intestine primary channel, the overview. Specific points of LI according to their function. Yuan source point is LI4. Luo-connecting point is LI6. Shi-cleft point is LI7. The associated back shoe point is bladder 25. Associated front new point is stomach 25. Now let's go to the 5 shoe transport points. Jingwell point is LI1. Ying spring point, or the water point, is, or the sedation point, is LI2. Shoestring point, the wood point, is LI3. Ching river point, fire point, is LI5. Husi point, earth tonification point, is LI11. The Hui meeting point, the opening point, and the lower Husi point, the Chao Hui meeting points. So with the small intestine primary and bladder channel, the Yang Wei Mai, so we have LI14. With the Yang Chao Mai, we have LI15, LI16. With the primary stomach channel, LI20. Jiao Hui meeting points of other channels with the LI channel include stomach 4, stomach 12, SI12, DU14, DU26, REN 24. According to some classics, gallbladder 5, gallbladder 6, gallbladder 14. Kao Wu command point for the face and mouth is LI4. Window of heaven point is LI18. Point of the 4 C's, which is also the Madan Yang heavenly star points, we have LI4, LI11. Sun Si Miao ghost point is LI11. Now let's go to points of LI according to region. Local points for the nose is LI20. Shoulder LI15, elbow, LI11, the hand, LI5, hand and fingers, LI4, fingers for numbness and pain, LI3. Regional points. For the elbow, we have LI10, LI13. Shoulder and elbow, we have LI14. Distal points. So for the forehead, eyes, mouth, or teeth, we have LI4. For the nose, LI3, LI4. For the neck, LI4, LI11. For the mouth and teeth, LI2 and LI4. For the shoulder, elbow, hand, and fingers, we have LI4, LI1. For the knee and foot, LI5. For the foot, LI2, LI3. For the toes, LI4. Specific points according to the course of the channel in numerical order. So for LI1, Jingwell point, metal point, or the pen point, or the five-face point. This is the distal point for the elbow and the hand. LI2, Ying spring point or water point, which is actually a sedation point. This is a distal point for the mouth or teeth. Distal point for the foot. LI3, shoestring point, a wood point. This is the local point for the fingers, especially numbness and pain. Distal point for the nose and distal point for the feet. LI4, the Yuan source point, Madan Yang heavenly star point, Kauhu command point for the face and mouth, important point for acupuncture anesthesia, distal point for the forehead, eyes, nose, mouth, teeth, jaw, shoulder, elbow, hand, and fingers, and the local point for the hand and fingers, especially stiffness. LI5, which is the shoestring point or far point, is a local point for the hand, distal point for the knees and feet. LI6 is the Luo-connecting point. LI7 is a she cleft point. LI10, which the adjacent point for the elbow. LI11, Sun Si Miao ghost point, Husi point, or the earth point, tonification point, Madan Yang heavenly star point, distal point for the neck, local point for the elbow. LI13, regional point for the elbow. LI14, Chao Hui, meeting point with the SI and BL channel, and the Yang Wei Mai, regional point for the shoulder and elbow. LI15 is the Chao Hui meeting point with the Yang Chao Mai, local point for the shoulder. LI16, Chao Hui meeting point with the Yang Chao Mai. LI18 is the window of heaven point. LI20, the local point for disorders of the nose. Chao Hui meeting point with the stomach channel. So this is the target areas of the large intestine channel. So we have the specific target areas for each point. We have LI4 for LI5, LI14, the LI20, particularly in the nose, LI7, LI15, 16, 17, and 18, and of course for the LI10 and LI11 for the large intestine. Thank you for your attention.
We continue our discussion on location methods and tune measurements. Still on the head, we discussed today lower face and chin, ear region, and the occiput. So on the lower face and chin, first we have here the mandibular angle. The mandibular angle corresponds to the area with where the lower jawline changes its direction from horizontal to vertical. It is located markedly inferior and anterior to the earlobe. This angle marks the location of stomach 6, which is one finger width anterior and superior to the mandibular angle, as well as stomach 17, SI17 and triple burner 16, which is at the level of the mandibular angle. Next, we have the masseter muscle. By firmly clenching the jaw, the contours of the masseter muscle becomes well-defined, stretching from the lateral aspect of the lower jaw to the zygomatic bone. It originates at the zygomatic arch and inserts at the mandibular angle. Here we have an illustration showing the zygoma, the zygomatic arch, and the temporomandibular joint relative to the points GB3, triple burner 22, triple burner 21, stomach 7. And another illustration showing where the masseter, the zygomatic bone, the mandibular angle, and the sternocleidomastoid muscle relative to triple burner 16, SI17, stomach 6, stomach 5, and SI18. Next, we have here the mentolabial groove. This forms a transverse groove at the junction of the chin and the lower lip. REN 24 is located in its center. Here we have illustrations of the anatomy of the ear, showing the helix, the antihelix, the antitragus, the lobe, the helix root, and the supratragic notch, the tragus, and the intertragic notch. And the acupuncture points near this area. So here we have the, specifically we have the helix root. This borders the upper part of the ear, and this is the location of triple burner 22. The helix root borders the upper part of the ear. As mentioned earlier, this is the location of triple burner 22. Next, we have the supratragic notch, which forms an incisure within the cartilage of the ear, separating the helix root from the tragus. This is point triple burner 21 and is located anterior to it. The tragus is where SI9 is located, anterior to the midpoint of the tragus. The intertragic notch forms an incisure in the auricular cartilage, separating the tragus from the lobe and the antitragus. GB2 is located anterior to this notch. Next, we have the earlobe. Inferior to the earlobe and the ear canal is a depression which is bordered posteriorly by the mastoid process and anteriorly by the lower jaw. The lower border is formed by the transverse process of the first cervical vertebra. It is where triple burner 17 is located in this depression. Okay. Next, we have the border between the auricle and the face. The border between the auricle and the face and the temple or the cheek generally forms a more or less vertical line, which will become more clearly defined by bending the auricle and tragus towards the anterior. Several points are located along this line from top to bottom, namely triple burner 22, triple burner 21, SI19, and GB2. Next, we have the mastoid process. The mastoid process is a cone-shaped bone structure which can be palpated posterior to the ear. Point GB12 is located at its tip, while the anion or the EXHN extra point can be found at the border of the mastoid process and the occiput. Acupuncture point EXHN 14 or Yiming is located somewhat more inferiorly. Next, we have here the transverse process of the first cervical vertebra. The transverse process of the atlas can be palpated inferior to the earlobe as a deep bony structure, which in most cases is very sensitive to pressure. Here we have an illustration showing the transverse process of the atlas, its axis, and its other parts, and another illustration showing the different acupuncture points near this area. Okay. Next, we have the craniocervical transition. The transition from the head to the neck is formed by the mastoid process, the adjacent dorsal musculature, and the occiput. The following points are located in this area, from the lateral to medial. These points are GB12, Yiming, Anyan, GB20, bladder 10, DO15, and DO16. Next, we have external occipital protuberance. The external occipital protuberance forms a flat projection on the posterior midline of the occiput, which can be palpated slightly superior to the craniocervical transition. It defines the location of DO16, DO17, and bladder 9. Sometimes, and more frequently in women, the protuberance may be defined only, poorly, or not at all. Next, we have the posterior hairline. The posterior hairline is used as a reference point for locating points on the occiput, but due to its variable position, it is not a very reliable landmark. Thank you for your attention.
Let's discuss window of heaven points. LI18 support the prominence. Location on the lateral aspect of the neck at the level of the laryngeal prominence between the two heads of the sternocleidomastoid muscle. How to find from the laryngeal prominence tip of the Adam's apple, draw a line across the sternocleidomastoid muscle to its posterior border. LI18 is located between the two heads of this muscle, which becomes more visible and palpable by rotating the head to the opposite side. Located on the same level are stomach 9 on the anterior border and SI16 on the posterior border of the sternocleidomastoid muscle. Needling, rotate the head back to its normal position before inserting the needle. Vertically 0.3 to 0.5 June or obliquely up to 0.8 June. Caution, carotid artery, jugular vein. Actions, indications, it benefits the thorax and larynx. Special features, LI18 window of heaven point, often used when swallowing is difficult, for example, after a stroke. LI18 is widely used as a local point for the throat problems, such as tonsillitis, mumps, laryngitis, aphasia, hoarse voice. This is also an important local point for nodules in these areas, such as nodules on the vocal cords and goiter. It is also a local point for thyroid problems. The ascending and descending of qi to and from the head. Its action in relieving cough, wheezing, and breathlessness is related to its being a window of heaven point. That is, subduing rebellious qi in the throat and regulating the ascending and descending of qi to and from the head. The explanation of acupuncture points says that LI18 is used for rebellious qi. The protuberance to which the point's name refers is the hyoid bone, the Adam's apple. It is important local point for the throat and voice problems, important local point for goiter and thyroid problems. In chapter 21 of the spiritual pivot, LI18 is included in a list of 5 points known as window of heavens, literally 5 regions of the window of heaven points. This passage states sudden loss of voice with obstructed qi in the throat. Choose LI18 and bleed the root of the tongue. LI18 shares certain important characteristics of this grouping in that it treats goiter and scrofula due to stagnation of qi and phlegm in the pivotal neck region, and sudden loss of voice, capping, and wheezing due to inversion qi. In clinical practice, LI18 is frequently used as an alternative to or in combination with stomach 9 in the treatment of difficulty in swallowing, especially following wind stroke and chronic disorders of the vocal cords. The neck is the bridge to our head, the home of our senses, and the heavenly part of the body. This bridge needs to be unobstructed. There needs to be free flow for change and evolution to occur. In the same way that the chi of this point supports the local physical structure of the laryngeal prominence, it supports and assists the mind and spirit so that the large intestine can release at this level and see afresh. All windows of the sky brighten the sense organs in the head. Our senses are the way we receive and interact with the world, and this point can revitalize our view of life. It can support and strengthen one's ability to let go from difficult or painful circumstances and allow new vistas and perspective to unfold. When combined with LI4, these effects are further enhanced. This point is important for the free expression of lung and large intestine qi, which make connections or bridges in relationships and allows letting go at endings. If the poor has been so afflicted by the sadness and grief that the heart and lungs have become constricted, then the natural condensing of lung qi becomes oppressive, and in turn this impacts on the large intestine. In its role as a propagator of the correct way to live, while synchronized with the natural rhythm of life, large intestine needs heavenly qi to give it the impetus to carry out its role and so enable a new cycle of experience. The lung and large intestine need sufficient sense of connection with the qi of heaven and the processes of life, that letting go will not cause anxiety or a feeling of deprivation, that know the cycle of life and inspiration will continue. A healthy large intestine official enables us to move forward with our life while retaining what is of value from the past. Support and rush out is a helpful point when a person is mired in loss, disconnection, and isolation, possibly moldering in toxicity and resentment in the past. They can see the next step to take. Toxicity distorts communication and comprehension and leads to misunderstanding. This point allows clarity and movement into the situation and helps bring balance to body, mind, and spirit. At the physical level, it benefits the throat. It's used frequently for throat problems, whether infectious such as mumps, tonsillitis, laryngitis, phlegm-related problems such as nodules or goiter, or in need of lubrication, hoarseness, and difficulty swallowing. Also, when there is rashes from ache, acne, or boils on the throat, this point can be used locally. It relieves cough, dissolves phlegm, and disperses masses. Thank you for your attention.
Now, let's discuss hoarse voice, acute tonsillitis, and sore throat, still under the heading of common cold and influenza. Now, so these are actually invasions of wind cold or wind heat. In the context of invasions of wind at the defensive qi level, we can now briefly discuss the treatment of certain symptoms that may be due to either wind cold or wind heat. Hoarse voice. Hoarseness may be caused by either wind cold or wind heat and is due to obstruction of the lung's defensive qi portion by wind. The lung is sometimes compared to a bell. It should be empty and give a clear, ringing sound, reflected in a clear and loud voice. If the bell is filled up, it cannot ring. Similarly, when the lungs are obstructed by a pathogenic factor, the voice may be affected and become hoarse, or it may be lost completely. The points to use, all with reducing method, are REN 23 to benefit the throat, 214 to clear heat and expel wind, LI11 to expel wind heat, lung 7 to promote descending of lung qi and clear throat, heart 5 to benefit the throat. Acute tonsillitis is caused by wind heat and if severe, toxic heat. The points to be used, all with reducing methods, are LI11, LI4, and stomach 44 to expel wind heat and clear stomach heat, which often causes tonsillitis. REN 22, lung 11, and lung 10 to expel wind heat, resolve toxic heat, and soothe the throat. If there is a temperature, bleed lung 11. If the fever is high, add 214. Sore throat is usually due to wind heat. The points to use, all with reducing methods, are lung 11 and LI4 to expel wind heat and benefit the throat, and stomach 43 to clear stomach heat, which often causes sore throat, especially in children. Thank you for your attention.